Dubai, Jeddah, Copenhagen, Bangalore. These are the cities where I conducted training programs in the classrooms, and Sydney as well. And last month we did a program in Sydney, and this month we did a program in Melbourne. And looking at the good response, I thought that why not have an online webinar to make everyone familiar with what is Lean and Six Sigma. So even if you're not from healthcare industry, you can still attend. Although I'll be taking all the examples from healthcare, but the tools and techniques are all the same. So feel free to ask questions. As we go along, you can also keep noting some of the links I'll be sharing, because I can't, I would like to give you more. I can't teach lots of tools and techniques in such a short period. So I would definitely like to give you more information, and keep noting down the links. So I'll be sharing a lot of links, and these are all free links to you. You can learn the tools and techniques used in the industries to improve the processes, and you can benefit from that. Okay, great. I think we have finished all the. So most of you are first timers. Okay, that's great. So thank you for telling me that. So I'll be starting from ground zero. I'll be assuming that you don't know anything about quality, and then towards the end, maybe I will, talk a little bit about complicated tools. They're not so complicated because nowadays you have got softwares and ChatGPT. Everything is so easy. What you couldn't think of 10 years ago, 20 years ago, which was only done by experts, now it's done by everyone. I think everyone finish the polls, please. We have finished the polls. Okay, great. Thank you. Thanks for that. And yeah, so I'll be talking about myself, about the company as well. Then I'll talk about Lean and Six Sigma benefits, and I'll introduce you to the Lean and Six Sigma basic tools. And after that, we will learn about DMAG, define, measure, analyze, improve, and control, which is the way to do a project. So in Lean and Six Sigma, what you do is you improve a process using a project. So what is the definition of a process? Process definition is something which you do again and again, which you keep doing again and again, which is repetitive in nature. Like going to office is a process. Eating food is a process because you're doing this again and again. Treating a patient is a process. Discharging a patient is a process. You have got some similar steps which you execute over the period of time again and again. But when you want to improve something, you have to take up an improvement project. What is the definition of a project? The definition of a project is it has got a starting point and it has got an end point. It doesn't exist after some time. So when you want to improve something, when you want to improve process, you can take up an improvement project. And then we'll see some applications in the industry. And so let me do a formal welcome to everyone. Hi, welcome to Anexas. Anexas has been consulting and training the professionals in the organizations around the world since 2006, and we have trained more than 150,000 people and consulted for more than 500 organizations, which includes Fortune 100 organizations too. I'm Amitabh Saxena, and I have designed this program based on my 30 years of experience while working in various industries across many domains. The whole Anexas team once again joins me in welcoming you. Okay, so this is about the organization. We have done training programs worldwide, and we have been doing the programs since 2006 as a chemical engineer, MBA finance, and then my wife is a pediatrician, so she told me that I'll be doing good job if I apply the Lean and Six Sigma concepts to healthcare industry, and that I've been doing for the last 20 years, and for the last 30 years I've been conducting training programs in Lean and Six Sigma uh, around the world. And this includes more than 50 hospitals. We have implemented Lean and Six Sigma and trained thousands of people, which includes more than 7,000 nurses, around 3,000 doctors, Ministry of Health of 3 companies, including UK National Healthcare Services. And we have got a lot of clients in Middle East, best of the best hospitals in Middle East. They are all our clients. So yeah, I think we have a national healthcare service. You just have a see, as I was informing and I was telling you in the beginning, that Lean and Six Sigma is applied. It's not only learned. Whatever you are learning, you have to apply it as well. So when you get trained as a green belt or a black belt, right now you'll be in a yellow belt. So I'll explain who's a yellow belt, who's a green belt, who's in a black belt in a short while. But when you are a green belt or a black belt, you typically do a project. And just imagine that some 10 or 20 green belts and black belts doing projects, 20, 25 projects in your organization or in your hospital. And if you're, let's say, in a large hospital, large setup like National Healthcare Service, NHS in UK, thousands of projects can be done. So imagine the kind of impact it will have. When a person gets trained as green belt and black belt, he or she has to present his work or her work to a panel of master black belts like me, plus the department head. And once both of us are satisfied, then they get the certificate. So that's how you get a certificate. And but if you are online, you can do a project in the classroom along with me when we train you in the online sessions. But as I said, I also conducted training programs in the classrooms. So for hospitals, if you have a hospital or in your clinic, if you want me to conduct a yellow belt session, it's totally just on invitation. I'll be happy to conduct a yellow belt training program, just like this, what we are doing today. And if you are interested, you can also take up in green belt and black belt. Now, let's understand. Once a green belt and black belt completes his project, how he presents. He presents, and this is one of our black belt from managers who has just presented his project, and he's happy that he has got certification. Well, we have Alex with us, and he has done excellent Lean and Six Sigma projects in National Healthcare Service and in hospitals. So, Alex, would you like to tell us something about it?
Hello, I'm Alex Wells, Head of Service Improvements at the Royal Liverpool University Hospital. I've been really fortunate to present today on how us as a trust are using Lean and Six Sigma principles to deliver better care for our patients. I've presented today on a lot of the work that we've done around how we've improved patient outcomes, reducing mortality, improving length of stay, and also talked about how we can actually realise some financial benefits from that. Over the past 2 years, we've been really fortunate that we've done some good work, and it's actually delivered us £2 million worth of quality efficiencies through delivering better patient care.
And also, there are lots of hospitals we have done. Andrew Robertson with us, who's CEO of King Edward VII Hospital in London. And we would like. Anyway, we have got lots of credentials, lots of photographs, even TV shows also. Those who are from India, they can see business show, very popular show.
Black belt from Anexas. All the best.
Yeah, and had some fun. American Society of Quality.
On 21st of May 2019, so I'm going to
so lots of projects, lots of industries, yeah, and lots of newspaper articles. Deputy Health Minister of Saudi Arabia and whole ministry is our client. Similarly, so UK and Saudi Arabia and UAE. we have done training programs. Okay, so I see some of you are from different industries. So let me tell you some of the common things, common bullet points, the similarities between all of these bullet points. So you can see a manufacturing company improved production, hospital reduced their patient discharge time, uh, recruitment cycle time got reduced. Every industry gets the benefit from Lean and Six Sigma, and we do conduct training programs for all the industries. Now let us have a look at what Lean and Six Sigma can do in the healthcare industry or for any industry. Lean and Six Sigma can reduce your costs. It can also reduce the defects, errors, waste, rework, cycle time. It can improve the quality, productivity, customer satisfaction, capacity, profitability, resilience, everything. And which CEO would not love a person who can who can achieve or help the organization achieve all these benefits? So Lean and Six Sigma green belts and black belts are loved by the senior management. And if you're a Lean and Six Sigma black belt, especially you're a master black belt, you can even become a self-employed professional. You can be a consultant. You can be a trainer as well. Hi. So I'll just, by the way, we also give you the videos like these. So when you attend our training programs in green belt or black belt, we give you full-fledged all the green belts and black belt videos. For example, here I'm talking about the same thing. If you're talking about the same thing, what I just said, I told you.
Wastes, rework, cycle times in a company.
So you do get all the videos, and here I'm talking about Lean Six Sigma history, etc. I won't focus too much on that today, but let me directly jump to first. I'll explain what is who's yellow belt, green belt, black belt, and master black belt. After that, I'll tell you what is Lean and what is Six Sigma, and then I will start showing you some of the tools and techniques. We'll learn some tools and techniques to improve our processes, some basic fundamental concepts, and towards the end, half an hour, if you are fine, I can even give you some additional tools and techniques which usually the green belts use, and I can show you how these techniques are utilized. But let us start with who are yellow belt, green belt, black belts, and master black belts. Yellow belts are those individuals who get trained for a shorter duration. Now, if it's like it could be a 2-hour program, a continuous 2-hour, or it could be half a day program to say 1-day training program spread over, say 3 to 4 hours with appropriate breaks. And they know the concepts, but they can't do a project. And those who have joined a little late, in the beginning, I did tell that Lean and Six Sigma is project approach towards process improvement. Process means something which is repetitive, and all of us are involved in processes. All of us are executing the processes in our organization, but project is something which not everyone does. So Lean and Six Sigma is a project approach. What is project? Project is a starting point, end point. It's a one-time endeavor. It has got a defined duration. So 3 months project to reduce the patient discharge time you would do, or 4 to 5 months project to reduce the infection rate. That's what green belts and black belts are capable of doing. So yellow belts can't do the project, but green belts, they learn some tools and techniques, and the black belts know a little bit more tools and techniques, and they are able to do better projects or bigger projects, or you can say projects which can run through 2-3 different departments, or organization-wide project they can do. So green belts and black belts are the sort of functions are same. Only things, the difference is the knowledge. The green belts have know around 50 to 60 tools. Black belts know around 75 to 80. I can say 100 to 100 tools. Master black belts are those who can train green belts and black belts. So master black belts, they can train the green belts and black belts as they do the project. They can guide them as they do the project. Master black belts can also run their own consulting organizations, and Anexas is one of the few organizations in the world which has been running master black belt courses for the last 20 years. So our Lean and Six Sigma certified individuals are doing good work around the world: US, Canada, UK, Europe, Middle East, Australia, India, and Beijing, in China as well. Let us look at the. Before I go for DMAC, let me give you a very, very brief overview. Like, uh, if although these figures look a little complicated, but don't worry. We'll be simplifying them in the next one hour, 1.5 hours. So, if you ask me what is lean, Lean Six Sigma actually comprises of Lean and Six Sigma. So Lean is about map the processes as they are being executed by using Gemba. Gemba is a Japanese word which means go to the field and observe, go to the place of action and observe how the things are taking place. Once you do a Gemba, you will observe lots of non-value added activities, lots of waste, which is those activities which don't add any value to the customers. And you'll be surprised to know that 60 to 70% of our time is, I can say, wasted in doing the jobs which don't add any value to the customers. So what are value-added jobs? Value-added something which the customer is willing to pay for, which is bringing the input closer to the output. But most of the time, you'll find that we are not doing value-added activities. We are doing non-value-added activities. So some of the non-value-added activities are overproduction, waiting, transportation, overprocessing, inventory, rework. We'll take some examples from hospitals very soon. So if you reduce the waste and try to reduce the cycle times and reduce the error and try to apply something called Pokayoke. Pokayoke means mistake proofing, also known as foolproofing. Foolproofing or Pokayoke, I will write for you. Pokayoke is a Japanese word. Pokayoke, Japanese word, which says even foolish people cannot commit a mistake. So design the process in a way that a person can't commit a mistake. Even if he wants to commit a mistake, he can't commit a mistake. So some tools like foolproofing or Pokayoke, identification of waste. Waste, of course, also known as in Japanese as muda. Yeah. So identifying the muda and reducing the muda. Muda means waste. And reduce the cycle time, reduce the errors. That is what is lean, in short. Six Sigma is about reducing the variation. Variation means, see, when the services are not consistent, sometimes you're too good, sometimes you're too bad. That's unpredictable, means I can't predict your performance. I can't predict your services. In such situations, we say you are unpredictable. Our services are unpredictable, and no one likes unpredictability. So if someone says that, you would always like to go to an organization, to a hospital, to a clinic as a patient, where you can predict the outcomes, and that too good outcomes. So you make the process better, and then you sustain it. You don't have variation. So reducing the variation is what is Six Sigma. So you improve your process and deliver efficiency consistently is what Six Sigma and Lean is. So I already explained to you yellow belt, green belt, black belt, and master black belts. You can also ask the questions if you have got any questions. As I'm okay, we have got Nura is asking, would you talk about FMEA? Yes, I can take up FMEA. Okay, I can take up. Nura, where are you from? You can inform me. Where are you from? I would be happy to give you some examples from your setup. FMEA, failure modes and effects analysis. What I would do is, although I'm not going to teach the FMEA in full, I will show you some examples and very briefly I'll talk about it. But if you want to learn FMEA in full, I will give you a video which is watched by 2.2 million people. It is about what is FMEA, and I have given a very simple example, day-to-day life example. You can learn FMEA and you can start applying FMEA next week. not next week, in fact, from tomorrow also, if you want. So FMEA, my team will give you in the chat box the link, and you'll be, I'm sure it will fulfill your requirements. So if you can tell me from where you are, so I can even specifically take an example uh, from your if you're tell me which hospital you're work, or it's just which setup you're working in. I will be happy to give a very very specific example. Thank you for that interaction, and you can keep asking questions. No, okay, fine. I see that. Yeah, so keep interacting with me. Others may not be able to. It is just to introduce the webinar, or we'll get a certificate. You will be getting a certificate of yellow belt. Yeah. So you will be given a link, and you will get a certificate of yellow belt as well towards the end. Yeah. Okay, fine, great. Any other questions? Feel free to ask. Keep asking. Okay, so now let us learn about what is DMAC. So I was mentioning, but before I go to DMAC, let me also talk about a little bit about lean first. Lean, the topic lean, which I was talking about, lean waste. Let us see. I'll be a little fast here because I'm thinking of giving you more and more tools in the shortest possible time. But feel free to uh, stop me anytime. If you have any questions, I'll be happy to answer them right away. So there are lots of wastes present in the system, searching, waiting. We are not even aware of. Overtime. Would you know that overtime is a waste? If in fact, overburden is also a waste. Yeah. Underutilization or overutilization of any resource or any equipment, any person is a waste. Okay, so to remember the wastes, we have got some mnemonics like you can say, if I want to go with this is I swim too, or there is another one called Tim Woods, or another one called downtime. Means if you rearrange those words, you'll get waste of intelligence. Waste of intelligence means most of the employees in the organizations, their intelligence is underutilized. They end up doing the work which doesn't use their brains to full. So brains in full. So that's what waste of intelligence is. Any scrap, rework, defects, errors in our products or services is a waste. Waiting, inventory, motion. So these concepts were taken, although they've taken from Toyota in Japan, but later on, for the last 20 years, they have been applied to healthcare industry very successfully. So let us have a look at those wastes. So how would you know what is a waste and what is not a waste? So beginning, I told you that if some step which is not adding any value, the customer is not willing to pay for, and it is not bringing the input closer to the output, or it is not done right the first time, it is known as the waste. Now let's have a look at this process. Walk to a OPD. Now it doesn't add any value. If the patient goes to the hospital, the value he or she is looking for is something which you can say the value is the patient would like to know his or her health status, status of health. But when you tell him to walk, register, again walk, these are all non-value added steps for patient. They're not adding any value to the patient. Probably the two steps which are adding value are drawing blood and blood test processing. Maybe these are the at this point of time we can think of them as adding the value, but remaining steps are not adding any value. So that is what is value added and non-value added. So we have done lots of work in multiple countries. This was a Chinese hospital we had studied, and uh, we found that 80% of the nurse calls were oh, brainstorming technique. I have used this technique in many organizations and we have obtained a lot of good results. In just 30 minutes, you can generate 108 ideas. How? Here the team members brainstorm ideas on a written form. It is also known as silent brainstorming technique. We take 5 minutes to write down 3 solution ideas on the first row of our form. So a form or a white sheet is given to each one of the participants, and in the 5 minutes they write 3 ideas. Once they have written down the 3 ideas, in the next 5 minutes again they have to write the 3 ideas by passing on the form to each other. You keep on doing this till the time you see back your own paper. You keep on circulating the papers till the time you receive back your own paper. So you can imagine that in the next 30 minutes, once the form is circulated to everyone and you have looked at the form of each other, you would have generated 108 ideas in just half an hour. While you are participating in 635 technique, you can add ideas by enhancing an idea already on the sheet, which is written by someone else. You can add a variation of an idea on the sheet, or you can add a completely new idea. Let us take an example. You want to generate the ideas on how to increase the awareness of Lean Six Sigma tools in an organization. So 6 people will be given 6 sheets. Each one of them would write 3 ideas in 5 minutes. Once you have written the 3 ideas in 5 minutes, after that you will pass on the sheet to your neighbor. Once the neighbor receives the sheet, he looks at the ideas of what you have written, and then he can expand on that idea, or he can change the idea a little bit, or he can write totally new idea. Similarly, you would have received sheet of another person. Again, you look at those 3 ideas written by someone else, expand on those ideas, or think of totally new ideas, because sometimes reading the ideas of others triggers ideas in our mind. In this way, you will continue the whole process for 30 minutes, and once all the rounds are completed, then you would have generated 108 ideas of how to increase the awareness of Lean Six Sigma in the organization. Okay, great. So, sorry for that. In a hurry, I forgot to plug my power to the laptop, and maybe I just got disconnected. So, yeah, coming back, so I was talking about some of the wastes, right? Some of the wastes, which, and I think I was here, right? So meanwhile, you learned about the technique, which I was actually supposed to give you in the improve phase towards the a little bit later half of our session. So how to improve the systems, how to generate the ideas. So just now you learned it a little early on. That's fine. But yeah, coming back. So one of the Asian hospitals, they determined that 80% of the nurse calls were from they're related to the housekeeping. It's wastage of the intelligence of the nurses, because nurses there to treat you, to give the uh, give the medicines, etc. But you see that if you keep the patients keep calling the nurses for my pillows dirty and my bed sheet is not okay. So in this case, that's intelligence, waste of intelligence. So there are lots of examples. As I said, I will be a little fast. I will not when I'm trying to give you many tools, I'll be a little. I would not be as slow as I would be in a typical green belt training program, because there you are trying to learn a tool. In yellow belt, you have to just know the tools. You have to be aware of that these tools do exist. But learning takes place in green belt or black belt. But just to give you some idea, we also did lots of projects in the US as well as UK, as I was telling in the beginning. And we have even published the results. We doubled the cardiology lab capacity from 8 to 16. We reduced diagnosis to exam time drastically. We cut down the admission from 17 minutes to 5 minutes and reduced the signatures. Lots of times you'll see that approvals, too much of approvals, signatures, unnecessary signature. You will be surprised to know that if you audit the process, because most of the time the process is not audited. You're following a process which was designed 5 years ago, 10 years ago, probably, maybe more than that, because no one had a look at it. I'm not talking about the main processes, obviously. I'm not talking about them, but the day-to-day, lots of processes, lots of steps you're executing. And they're designed by someone maybe 5 years ago, 10 years ago. The technology has changed, the setup has changed, sometimes the layout has changed, but the processes remain as they are. And you will find that people just blindly keep following the processes without questioning, even though they know that these steps don't add any value, but they still keep on following them because they don't want to deviate. They feel that they have to follow the processes. So obviously, approvals, you can see these are very simple things. Reducing the waste, like if I take the example, patient had to wait up to 6 days between the cardiologist exam conducted in the doctor's office and the treadmill exam conducted in diagnostics lab. After observing the patient flow of patients from the cardiologist office to diagnostic lab, this was observation. This was Gemba. Gemba means going to the field, going to the place of action. Two physicians decided to see the patients in the diagnostic lab, and patients now make appointments to see the cardiologist there. And the daily schedule for diagnostic exams was changed so patients could get both exams done the same day. Now, just by having a relook at the processes, you can really make a huge difference. So idea is to reduce the waste as much as possible and to deliver the value. And some other examples: unnecessary waiting, unnecessary transportation, errors, unnecessary stocks, unnecessary processes. These are all examples of waste. Underutilized resources or overutilized resources, both are waste. Underutilized equipment and overutilized equipment, they are waste. Cost of a 5-minute MD walk, it's a waste. A surgeon is waiting for the operation theater to get ready. It is a waste. Some more examples. So you can see the walking to the elevator wait, elevator travel, etc. If you do calculate all these things, you are able to see that lots of waste in the system. Just travel, just going in the elevator, it means so much, millions of dollars, because if you have 200 nurses multiplied by 365 days, multiplied by $12, comes to some few millions of dollars. So that much of waste is present in our system. And that was just one example. There's a lot of waste. And that if we calculate, you can see that lots of opportunities of improvements are there. Lab and pharmacy on second floor, radiation equipment on ground floor. Why don't we have them all on the same floor? Any interruption is a waste. Similarly, pokayoke, rice cooker, by mistake also the rice will not overcook. That's an example of a pokayoke I was talking about earlier, mistake proofing. So let's have some examples of mistake proofing. So smart machines cannot be set or not operated beyond normal, safe, or maximum levels. That's a pokayoke example. Similarly, some other examples means by mistake also, if the normal range is 0.001 gram to 0.01, 0.1 gram will be rejected. That's an example of pokayoke. So we can think of lots of pokayoke applications in our healthcare industry and in any other industry. If you belong to other industry as well, you can think of another example, oxygen and nitrogen cylinders. The connectors are different. You can't connect them to each other, even if you want to. So you can't connect oxygen to nitrogen line, oxygen cylinder to a nitrogen line, even if you want to do that, because they won't get inserted. Then other some examples, fixed number of packages during surgery, complete catheter kits for insertion, prepackaged medication cart with correct dosage. These are all examples of pokayoke, means you are trying to eliminate the errors. You are trying, even by mistake, you will not commit a mistake. So that's what some examples were. Okay, so that was about a brief overview of lean tools. Now let us talk about the DMAG. So when you are saying that you can do a you do a project when you want to improve the process, you need to do a project. Now, when you do a project, you follow 5 phases. DMAC, define, measure, analyze, improve, and control. I'm talking about a Lean Six Sigma project. So if you want, now I'm thinking here, okay, it's rather than taking recruitment time process of recruiting of nurses, I'll take patient discharge time example. Okay, so let me give you a very brief overview of what a typical project would look like. And then after that, we will do a project. I'll show you how a project is done. Along the way, you will learn some tools and techniques. You will not learn, but you will know about these tools and techniques, because I'll be doing the project with you or for you. But when you join my green belt sessions, you will be doing a project with me. So we'll do it slowly. So we take up some improvement projects and we learn the tool and we apply the tools and techniques to that particular project. So what is define, measure, analyze, improve, and control? So let us take example. Define means first you define the problem. See, whatever you want to improve, so you have got some current state and then the future state. And that difference between the two states is the problem. So for example, patient discharge time. Let's say, so I will write a problem statement and a goal statement. Problem statement is patient discharge time is 5 hours. Goal statement could be patient discharge time I want to be, let's say 2 hours. Okay. So this could be my define phase. We could have project charter. We could write the team members' names, etc. on that. In the measure phase, we collect the data. So we don't trust anyone except data. So Dr. Deming was a quality guru. He said that in God we trust, rest others bring data. So we're not going to trust you unless you show me the data. So if you say we are taking 5 hours, show me the data. So you collect the data. So let's say if I take an example, one patient took 5 hours, one patient took 6 hours, one patient took 5 hours and 5.5 hours and 4.5 hours and 4 hours and 5 hours and so on and so forth. So if you collect almost around 30 samples, and 30 is a very good sample size. to make a judgment about a process. Now, you'll be surprised to know that it's true. If you are making a judgment about any data, which is we call it as variable data or continuous data, which can be expressed in numbers, like this one, we can just collect 30 samples, and you will be able to get full information of like population. So how can we do that? We can make a histogram. So suppose most of the time your patients are being discharged in 5 hours, but not every patient will be discharged in 5 hours. Some of the patients will be discharged in maybe 2 hours also. Some patients may be discharged in 8 hours also. Yeah, there's a possibility like that. So this, all the processes follow Gaussian curve. Gauss was a mathematician in the 17th century, 16th and 17th century, who found that all the repetitive processes, they follow normal distribution. This kind of distribution is known as normal curve or normal distribution. So most of your, patient discharge time, waiting time, age of the patients who are visiting your clinic, they're all distributed normally. So as I was informing, that this normal distribution is so normal, that's why it is known as normal. It's known as normal distribution, like bell-shaped curve. It's known as normal distribution. So in the measure phase, we collect the data, we depict the data, we share our graphs, and we find that this is how our process is working. We also call it as, if I make it on a line chart, so this is a histogram. Histogram is historical graph, histogram. Historical data compressed into one a normal curve is known as histogram. But if I spread it over the period of time, it would look like one patient took 5 hours, another patient took 6 hours. So the waiting time would look something like this. Yeah. So not every time you are taking 5 hours, sometimes 6 hours, sometimes more, etc. So if you see, like, it will look like this. So here, if I take the same example here, 2 hours to 8 hours. So we call it as lower control limit, 2 hours, and upper control limit, this is 2 hours. Sorry, not 2 hours, it is 8 hours. Sorry for that. It's evening. Evening for me. I'm in Australia right now. So it's a little, yeah, I had after a full day of work, I'm conducting the session. So a little bit of tiredness will be there. Yeah. So this is typically, we call it as control chart. So please remember, we call this lower control limit, upper control limit. Now, it has nothing to do with control as such. We might get an idea of control means we are trying to control the process within 2 to 8 hours. It's not like that. And unfortunately, the control limit just means it's voice of process. It just tells you how our process is behaving. Means if you go to this hospital and you're a patient and you'll get discharged between 2 to 8 hours. This is the process performance. So the measure phase, we measure the performance. Then comes the analyze phase. Why we are taking so much time? So whatever we want to improve, we want to improve patient here discharge time. We designate it. So here problem is patient discharge time. I'll show you this a little bit later, all the detailed project in a short while. And I'm giving you an overview. I hope it's not too congested for you. If you are watching in mobile, maybe of people, they watch in mobile. If you're watching in mobile, switch to laptop if possible. Otherwise, that's fine. You can you know how to blow up the screen, etc. So yeah, so coming back in the analyze phase, so this is our why, patient discharge time. Patient discharge time, whatever that measure we want to improve, we call it as the why. Okay, so we put that why in this box and make a fishbone diagram saying that why I'm taking so much time. And the causes of these delays in patient discharge time, we call them as X factors. Okay. So we brainstorm on all the X factors. And then once we do that, then we prioritize which factors are taking more time, which factors are responsible for bigger issues. We call it as Pareto chart. I will explain the Pareto chart after a while. Pareto chart. Pareto chart is also known as 80-20 rule. Some of you might have heard of that 80-20 rule. Wilfredo Pareto was an Italian economist who found that 80% of the wealth in Italy was with 20% of the people. And he found this to be true in all fields. 80% of the crops were produced or 20% of the crops were contributing to 80% of the total production in Italy. You will also know that 80% of your patients are being treated for 20% of the different types of diseases. Suppose you're treating 100 diseases, but 20 diseases, 80% of your patients are coming with those 20% of the disease problems, related problems. So this 80-20 is present everywhere. So although there might be lots of causes for your delayed patient discharge time, but only 20% of them. So if you have listed 10 causes, only 20% means 2 causes will be responsible for 80% of your delays. So which are those? You find them and then attack these causes. Find the solution to these causes. And once you find the solutions to these causes, then you will improve. So let's assume that, and I'll show you a project, how this project was done. I'll show you. It was done in a real setup by hospital. So of course, I'll remove the name of the hospital, etc. I'll make it a neutral template, and I'll be presenting it to you. And some of the tools, although lots of tools you will see in that project, but some of the tools I'll explain, and some of the basic tools I've explained to you. So I'll explain how typical project in real life it's done. So let's say we got some 2-3 causes. We'll attack those causes, we'll find solutions, and we'll generate solutions like the one we saw 635 techniques in between. When I lost my power of my laptop, and you could see. Also, as I'm talking, my team is giving all the links in the chat box. Please save these links. They are about all the videos, like the ones we just saw, about all the tools and techniques of Lean and Six Sigma. You can apply these tools and techniques right away. Next week you can start, improving your processes by applying these tools and techniques in bits and pieces as well. So coming back, you got the solution to the root causes, and once you apply the solution, you are able to reduce the patient discharge time to let's say average 2 hours, with the lower control limit and upper control limit. Now new lower and upper control limit as 1 and 3. So means you are changing the control limits of your process. Okay. So now your process, patient discharge process, is telling you, like so voice of process is telling you that, well, now I have reduced my time of discharging the patient. Okay. So you can also see the tools and techniques like Pareto analysis given in the chat box. You can also subscribe to the Anexas channel. It is our company's channel where you can get all the tools. You have got yellow belt, green belts. Some of you are, I see some of the people are attending from Middle East also. You can see in Arabic as well, and some people are coming from India. Okay, so you can see in Hindi as well. Okay. Nowadays you have AI, so everything is available in all languages. Okay, great. So this was a brief about DMAC. Now let us see. Let us apply DMAC. Let me show you a project. Okay. So what I'll do is I will mm, show you a project which was done by. Okay. What I'll do is I'll show you a project which was done by one of our uh, uh, students as she was attending, doctor was attending the session, and we have just removed it is present in the normal template, a standard template which a typical green belt or a black belt uses, and so the purpose will be served. We don't want to know the hospital, etc., and some of the things which are not related to yellow belt, they are green black belt tools. I'll just describe them. As I was mentioning, you will not be you will not be able to understand them, obviously, but because you have not learned about them, but at least some little bit of idea will be good enough. So when you are doing a project, DMAC project charter, you write a DMAC project charter. So you write a problem statement here, the way it is written, and a goal statement. I was talking about in the define phase, you write a problem statement and a goal statement. And I will skip some of the slides because this is a full project, so I'm not going to describe everything, but some of the very, very specific things. In the measure phase, you collect the data. So you collect the data, you make a data collection plan. How would you collect the data? How many samples you will collect? And then you display the data. So it's so easy nowadays. As I was mentioning, that you don't have to collect too much of samples. You don't have to collect 100, 200, 5,000 samples. They're not going to add any value. 15, 20 samples are going to give you a shape. And if you collect 3,000 or 30,000 samples, the shape will not change. The values won't change. You will fill in, if I just let me show you. Yeah. So if I show you this, the data, and if I collect few samples, look at the column number C2. And when you join the green belt session, we teach you, give you this tool also. There's so many tools available in the market. You can choose anyone. We give you the tool and we tell you how can you do the project in few clicks. You don't have to really study too much of statistics, number crunching. Everything is not needed nowadays. You have got all the tools available. You have got the data. You can do wonders with the data. You can analyze the data. You can make conclusions from the data. And so easy to do that. In just 3 days of training, you can understand all these things. You can do a real project. You can make a positive difference to your organization. So this is baseline discharge time. If I just put it here, here you can just have a look. Okay, let me quickly do a histogram here. Yeah, so here you can see that we have got a patient discharge time. We can see average is 300 minutes. Now, when in statistics, if you're interested in hours, you measure in minutes. If you're interested in minutes, your KPI is measured in minutes, then you'll measure in seconds. So this improves the resolution. So we are measuring in minutes. 300 minutes is almost 5 hours. And the standard deviation is something called standard deviation. Every time we'll get standard deviation. If you remember, I was talking about the histogram. Carl Friedrich Gauss he found that just let me have a look at, okay, a lot of people, yeah. Anyone, yeah, I just wanted to know, so around, we have got quite a number of people, and I have now many people have joined in. I hope, mm, even if you joined midway, you are able to understand whatever I'm talking about. If you want to ask any question at any time, feel free to ask right in the chat box. I'll be happy to explain that part to you. Although the purpose of this whole training is to give you glimpses, so to show you what typically green belts and black belts do, and that's what makes you a yellow belt. But still, if you have any questions, feel free to ask. So thanks for joining. You lots of people I see. Anita is there, Asma, Bhagat, Bhavna, Bhavani, Charles, Fatima, Gyanvi, Imran, okay, Noora, Parth, Razan, Rich, Rose. Okay, fine, great. I see lots of people. I can't, uh, yeah, so good. So all of you, Charles, yeah, Dr. Huma, okay, fine. All of you, if you have any questions, feel free to ask questions. Okay, great. So, yeah, good to see. Anita, you are the one who's interacting with me right now on the WhatsApp. Good to see you here if you are the same. Okay. Okay, Darsha, yes, thanks for, yes. Okay, great. So anytime, if you have any questions, feel free to, feel free to ask questions. Now, yes, so average, so if you are okay a little bit, okay, okay, so if you have got like, let me, uh, if you're fine, and if you, although it's a green belt stuff, but let me tell you that every process, Gauss found one interesting thing, Gauss, sorry for that. He found one interesting thing, that all the processes, repetitive process, they follows a distribution called normal distribution. If you collect, he said 30 samples, you get an average. So for example, in our case, average was 300 minutes. Okay. And standard deviation was 25 minutes. If I remember correctly. 25 minutes or whatever, it could be any number, 50 minutes, 100 minutes, doesn't matter. So 25 minutes, let's say. So if you just know these two numbers, you can predict about 99% of the total population. Now, how would you do that? And it's a mathematical theorem. It's true in nature that here you will be having an average. And if you just, make it, this is plus 1 times standard deviation, plus 2 times standard deviation, plus 3 times standard deviation, minus 1 times standard deviation, minus 2 times standard deviation, and minus 3 times standard deviation. Now, I hope it's not too heavy for you right now. This is the only 2-3 concepts in Lean Six Sigma are a little statistical in nature, but remaining are perfectly okay. They're pretty simple, so don't worry. So how would you predict, like if I get my 30 patients data, it's telling me 300 minutes. So 1 time standard deviation, how much is our standard deviation? 25 minutes. So 1 time standard deviation will become 325. 3 times standard deviation will become 350. I'm just adding 25, 25, 25. And the 3 times will become, I think, 375, right? 375. Similarly, if I go here to 275 and 250 and 225. So I can predict that all the patients who are being discharged from the hospital, they are going to be discharged within these lower control limit and upper control limit, means they are going to be discharged within 225 minutes to 375 minutes. These we call it as control limits. Yeah. LCL is here 225 and UCL is 375. And you don't have to do calculations. Everything is done by, nowadays you have to click the buttons. I think, give me 2-3 years, you have to just speak. All the charts will be created. You don't have to, So for example, so here, if I want to ask, can you please create a control chart for me? Why not? It says, I would do it for you. Just, you get a control chart. You can say, oh yeah, actual values, looking at the actual values, 227 minutes to 379 minutes. Okay. So these are the values taken from the actual readings. So this is how our process is behaving. And you can predict that any patient being discharged from this hospital will be falling within these 3 limits. Well, we are not happy with those limits, obviously. We want to reduce it. Yeah. And this is also another perspective of looking at your process. You're not looking at means. You're not looking at means. You are looking at the variation too. You're not, like, otherwise, we are lost in that. Well, something low, something goes high, we are very much worried. Then something goes low, we are happy in case of cycle time. Then again, happy, no, unhappy. That's not the way to look at the process. You have to look at the process as a whole. We are taking between 225 to 375. Okay, this is how our process is. That we want to change the DNA of a process, the DNA of the process to different limits. So rather than getting lost in day-to-day numbers going up and down, you have a bigger picture. That's what you typically do. Okay. Yeah, so that was, I just wanted to show you that this is how you typically do a project. I'm just showing you how project will do. Now, that was measure phase, but now you go to the analyze phase. Why we are like that? So make a cause and effect diagram. You brainstorm on all the possible causes. Brainstorm on all the possible causes without any prejudices or without being too emotional. Brainstorm all the possible causes using a technique called 6M's technique. What is 6M's technique? In the fishbone diagram, you have 6M's. Man, machine, material. If you see here, machine, methods, environment. Environment is mother nature. You can make it mother nature. Measurements, material. Instead of personal, you can say man also, just to make it mankind, what, just M. So some people make it 6M's. So try to brainstorm on all the possible causes. And this was given by Dr. Ishikawa. That's why it's also known as Ishikawa diagram. And then you have got here, they have listed the hospital staff. They came together, the team came together. So when you're doing a project, you generally use a team. So they came together, they are doing a project, man, machine, material, whatever they could think of. And after that, they make a cause and effect diagram. Okay. So everything, whatever they listed, is now presented as a cause and effect diagram. Then they also go for, after that, they go for control impact matrix. So what is in our control, what is out of control, and high, medium, and low impact. So you try to prioritize the causes which are more important and which are in our control. And then further, you can collect the data on that. You can also do a Pareto analysis. Pareto analysis is something where you try to identify how many times a particular cause was responsible for that problem. So just to show you how it is done, and I'm doing, as I said, I'm not teaching you a tool, I'm showing you the tools. So it may look like a little that, I'm moving a little fast, but the purpose is not to teach you the tool. The purpose is to show you the tool, that these tools exist. And you can learn these tools very easily by, of course, joining my green belt sessions. I do online sessions also, and I do um, in classrooms as well. If I'm in your city, I'll be happy to do a yellow belt training, half a day yellow belt training, complimentary for your hospital. Only for hospital it is applicable. Yeah, for industries also, let it be. Yeah, it can be applicable for some industries as well. And so you get an idea what Lean Six Sigma looks like. So coming back, so they collected the data for reasons for delay. You can also brainstorm, or you can do voting also. Suppose you can't collect the data, you can do voting. So ask the team members to vote for the causes. So most of the votes you can see they have taken reporting not accurate if it's a voting process. Otherwise, you can go to the real data. How many times reporting not accurate occurred in our causes which were listed down by our team members? You will see that 27 times it was a reporting not accurate. Discharge summary delay was 8 times. Staff not available 23 times. So what they do is they arrange the data in descending order. Okay. So typically, if I were to make a Pareto chart, and nowadays, as I said, you don't have to struggle too much. Just do a Pareto chart. Just ask for a Pareto chart. Oh, please make a Pareto chart for me. I think voice instructions will be available very soon. In fact, it's available in ChatGPT now. But yeah, you have to understand those tools. Then only you can ask the right questions, right? So you have got your, you see, how many times reporting not accurate occurred? 27 times. And percentage contribution is 29% total out of the total. Similarly, staff not available, pharmacy delay. So if you see the percentage contribution of the first four, 29%, 25%, 12%, 8%, combined together comes to around 75% or 75 to 80. So if you just look at these first 3-4 causes, it will solve your 80% of your problem approximately. 80-20 rule. Remember that 80-20 rule. This line is the cumulative line, means first two causes are giving you first is 29.7%, 25. If you take the sum total, it's 54%. So first one is 54. The next point is 67. So if you go reach up to fourth one, it's giving you around 80% of your total discharge time is contributed by these 4 causes. So why not focus on only 4 causes? Why to worry about other causes? Okay, so that's how you typically do a Pareto chart. And then you can do further analysis also, which if you are interested, you can attend we have got more analysis as well. I'll not go into the too much of details of that. You can further investigate, further validate your data using some of the some scatter plots, box plots, everything. We teach you everything. And we tell you how to analyze the data, how to make sense out of the data, and with few clicks. All these tools are available in Excel sheet also, but we are not aware of those tools. So that now once you have done that, then so I'll just skip some of the parts, or maybe towards the end, if you are willing to stay a little bit more. Although we are going to end, I think we're supposed to end in 10 minutes, but if you're willing to spend a little more time, I'll be happy to, tell you about some more tools. It's very, very good tools are there. You can also do an FMEA, failure modes and effects analysis. So because one of you had asked about it, you identify the wastes in the process. What are the wasteful steps in the process? Okay. And then you do an FME. FME means you imagine how you will fail. Yeah, so I'm just showing you very brief example, but a detailed example is given. Detailed example is given in your chat, in the link. Please do watch. It's a 18, I think, 18-minute video, 18 or 16 minute, I forgot. 2.2 million views. Many of our videos, many of my videos, I can say, they have got lots of views. So I'm sure people must have found some benefit from them, and why not get the benefit? So please go ahead. Yeah, my team keeps telling me you have to say subscribe to my channel, etc. Whatever, if you want, you can subscribe, and otherwise, just watch the video, and you'll be definitely uh, feel very happy. And if you subscribe, we'll keep our training programs free like this. Um, and we, yeah, and of course, if we can get you in the classroom sessions, why not? If your hospitals are also interested, I'll be happy to conduct those sessions. Okay, coming back. So first, in the FMEA, you write the process. Okay. What is the failure mode? So one of the failure mode is preparation of summary delayed. What is the effect of that? What's the severity rating? Severity rating is 1 to 10. 1 to 10 means 1 to 10 means 1 is very low severity, 10 means very high, very bad. Any number which is higher is bad. It's a high risk for the organization. So here it's, we'll say 8, 8, 8. 8 means I'm giving the for delayed discharge is 8. Okay. If it's like very hazard, patient safety is at stake, death, etc., it will be 10. But yeah, here's like when 8. What are the potential causes? What are the potential causes of that? So these are the questions. Now, how frequently they occur? This is known as occurrence rating. So I'm very briefly telling you. Details you can see in my in the video. It's a detailed video of 18 minutes explaining full FMEA properly, how to give the rating, etc. And also, I've taken a very simple day-to-day life example. You will understand FMEA really, really so easily. But right now, I'm just summarizing. So look at this: 1 to 10. 1 to 10 rating. If it's occurring more, it will get higher rating. That's a more risk, right? And if it's less occurring, it will be lower rating. Then controls. What are the controls? What are the controls? Existing controls to take care of so that the causes don't impact you. So you write those controls. And 1 to 10, again, rating, detection rating. If it's a bad control, it will take 10 number. Remember that. And if it's less, it's easy. Its control is very good. It's able to control the cause or prevent the mistake or error or delay. Then it will be 1. So 1 to 10 scale again. And then you multiply those 3 ratings to get your risk priority number, RP, and those who can't read it, and if you're in mobile, you can't read it, RP and risk priority number. Risk priority number is multiplication of these 3 numbers, severity, occurrence, and detection rating. Then highest, wherever you get the highest risk, there you can take an action and give a solution. So very briefly, I explained to you, but those who are interested, FMEA, you can watch the full video. Anyway, so we go ahead and we look at the yeah. So we got some root causes with us, and then we have got some solutions. And then once we take an action, you are able to show improvements, statistically significant improvement. So the lower control limit and upper control limit, which was earlier higher, have now, you have got a new process, a reborn process. And that's what is a typical Six Sigma project looks like. So you get all the tools and techniques. You get to know how to do this. It's a 3 days program. You can always attend this 3 days program. I will tell you when are the dates. We have got lots of dates for Melbourne. The coming Saturday, I'm doing a training. I keep doing every Saturday. Melbourne, you typically. Next month, I'm going to do the trainings in Dubai and Riyadh, and after that, Bangalore. So I keep moving from city to city. Normally, I stay in Australia, but most of the at this point of time, I would say most of my clients are in Middle East. Some of the clients are in Australia too. Some mining companies. Then we have got some hospitals here and some banks also. So yeah, I hope you got a good picture. My team will tell you about, no, if any questions, and I'll be, if you're willing to stay for a longer time, I'll show you some processes. I'll show you some examples, some more tools if real a good time you have got. But my team will just tell you what are the, uh, mm, if you are in Melbourne and if you're okay with some, um, if you've got a place to conduct a training program, like you're a hospital or clinic, or you've got some setup with you, then the cost reduces drastically. So I hope if you're in Melbourne, the biggest costs are the venue costs. So it reduces drastically. Same true for Dubai, Riyadh, Jeddah. I do training in Dammam. So if you are in, if you've got a place, the face-to-face cost reduces drastically. Otherwise, online training cost is very, very low. So if you want, you can attend our training programs anytime, and my team will show you the uh, the different days. For online sessions, typically we have evening programs. Um, Looking at your time zone, your evening programs, we have got lots of training programs. We have other programs also, like CPHQ, Certified Professional in Healthcare Quality. Our success rate is 95%. CPHQ is a very reputed exam connected by NHQ in US, and we have 95% plus success rate, which is very, very high. One of the highest in the industry. Project management professional also we do. Other trainings also. The first three trainings I conduct. Then we have Power BI, business analytics also, data science and AI programs as well. And lots of consulting we provide. I provide lots of Lean and Six Sigma consulting. If you are interested to get those services, please connect with our company. We have got other consultants also. But if you register for Melbourne, as I was talking about face-to-face, typically I'm doing these trainings. There are other countries, UK, we have got other trainers as well, Canada, US. Yeah, so these are the places, and we have already scheduled one program. If the 3 days, one next program is 18th, 25th, and 2nd May. If you are interested, please let me know. Otherwise, next schedule will be in July or August. Just let me know anytime you have got your dates, convenient days. We'll try to schedule those programs as per your convenience. And some of the healthcare projects done by increasing staff satisfaction, patient retention. Retention in the sense means it was a private hospital, and patients, whenever they have a disease, I'm not talking about like coming back for the same disease. Like whenever they treat you as the preferred healthcare provider, reduced discharge process, turnaround time. So many projects are listed here. These are some examples. And apart from that, other domains, other companies also, we have done lots of projects. Every project reduces cycle time, reduces errors, reduces defects, lots and lots of benefits, tangible as well as intangible benefits. All accreditations are there. Your certifications are all valid worldwide. It's the yellow belt, green belt. Yellow belt you are going to get anyway today. Green belt, black belt, everything is valid. So we have got those validated. Very good. Thanks for joining us. And these are some of the fee, but for other countries, the fee would be different. So if you can specifically tell your location, what's your location, and we'll be happy to give you the location a specific fee as well. Great. So thanks a lot. Thanks everyone for attending this session. And those who are interested, as I was mentioning, I'll tell you how Lean Six Sigma is implemented in a typical organization. And if you want to register for our training programs, first, how to get a yellow belt certificate. There's a link given. You can always register, go to that link and get your certificate. And this link will be sent to you in your mail. If you want to join our courses, you can register our courses as well right away. If you register, there is further some discounts applicable. Okay, now, okay. Yeah, let me show you how typically you will implement Lean Six Sigma in an organization. Okay, maybe I'll show you that. And after that, what I'll do is, I will depending on how many people stay back. So if you're still staying back, then I'll further talk about some more tools and techniques. So if you were to, if you were to implement Lean and Six Sigma in an organization, so typically in a hospital, from different departments, you choose projects, and then you create a steering committee with a quality leader. And we first train the department heads. They are called as champions or sponsors. The sponsors or champions, they get trained. Very brief information like the one I did give it to you. Some very high level view, you can say. What could be the benefits, how to choose the right projects. That is a kind of typical training is given to them. And then they choose the projects and allocate these to their staff members, nurses, doctors, physicians. They usually take up projects, and as a green belt and black belt, they get trained. And once they get trained, they then can do the projects. And you can imagine in a typical hospital, 10 projects completed in 3 to 6 months time, it can transform the organization. Then every 6 months you do the projects. You can imagine how it has a positive impact on the organization. So this is how, and as I was showing you in the beginning, once you do the project, you get certified as a US.
Hello, I'm Alex Wells, Head of Service Improvements at the Royal.
And there are so many examples from different industry also. So I will not go into so much of showing the videos, etc. Let me jump to let me teach you one more tool. If you remember, I showed you something called CPHQ in the beginning. I did not, because we had not learned, so I did not specifically mention it. But see, when we are doing a project, you start with a CPHQ. What is a CPHQ? So I'm just now for those who who are having something else, they can. We have completed the yellow belt session for record, yeah, I'm just extending the session because I see many of you are still there. So let me show you some more tools, some additional tools. Okay, so let me talk about CPHQ also. So typically when we want to improve a process, first we have to have a high level view of the process. Okay. And to understand this, let me draw the system map of an organization, of any organization in the world. It's not only for a hospital or a clinic or a lab. It could be it could be your department also. Typically, if you look at your organization or your department, you have certain inputs. And they are processed through a series of steps or departments, and you produce your output, which could be a service or a product. So you provide a service. The service is consumed by the customer. Here, customer could be patient, customer could be government, customer could be family members of the patient, customers could be shareholders. If it's a private hospital, shareholders. Now we have got suppliers. Suppliers are providing with the inputs. And then we have got feedback received from the customers and the demand predicted from the customers. Planning or strategy team, they inform the suppliers to provide the inputs. It could be medicines, it could be resources. HR department needs to hire the resources. Whatever are the inputs. And they also inform the planning or strategy team, they inform the departments to change the parameters based on the feedback received from the customers. Our aim is to add the value to the customer. Customer is not interested in the product or the service. Customer is not interested in the output. Customer is interested in the value addition the output provides. Let's say, for example, if you're treating a patient, so patient treatment is an output. But customer is not interested in the treatment. Customer is interested in the improved health. Health improvement is the value. Yeah, of course, it is delivered through treatment. Yeah, but what is the value? So the hospitals which focus on value, or any organization which focuses on value, is innovative organization. Okay. So yes, so coming back, this is known as systems map, also known as value stream map, because how the value is created. Value stream map. Value stream map, VSM. One more tool, just to remember, this is one more tool for you. Value stream map. And if you pull out this, if we call it process, SIPOC, a mini version of value stream map is known as SIPOC, supplier input process output customer. So you start with a SIPOC. So when you want to improve a process, when you want to do a project, you first tool which you use is a SIPOC. Okay. And then you go to the charter. Yeah, I showed you the charter already. Why do you work? Why you are so concerned about the SIPOC or the process? Because problems are in the processes. Problems are not in the people. Problems are in the processes. Let's say 1,000 people are working in a hospital. You ask any staff member, what is your target of customer complaints today? How many patient complaints you want to receive? What is the target? He will tell you, well, it's zero. I don't want. There is no target. But by the end of the day, you will say that 50 customer complaints the hospital would have received. It won't be 50 every time, sometimes 50, 60. So it will also have a control limit. You will typically find that it is between 35 to 65, let us say. The average is 50, standard deviation is 5. So 55, 55, 60, and 65, and here. Typically, every process looks like that. I was telling you earlier. So none of the 1,000 staff members have got a target that today we'll achieve 35 to 65 customer complaints. They don't have a target like that. But who makes the why? But this happens every day because of the process and system which is designed, the way our resources are trained, the way we operate our equipment, we have the facilities, etc. This is going to deliver our SOPs, policies, procedures. They are going to deliver 35 to 65 complaints. And if you want to reduce it, there's no point in telling the staff member, these 1,000 people, you just keep telling, you can't declare that everyone receives a $1 million if you achieve zero customer complaints. They'll try their best, but they won't be able to achieve. They'll still achieve 35 to 65 unless you change the process. To change the process of the system, the same people will deliver between 0 to maybe 20, 0 to 10. Even that is improvement. But you have to change the process. You have to do a DMAC project, define, measure, analyze, proper define, measure, analyze the root causes, improve, identify the root cause. Then only, it can improve. So that is what I just wanted to tell you. One tool, SIPOC. I hope you SIPOC. And why SIPOC? Because problems are in the processes, not in the people. Yeah. Don't blame the people. Don't blame. No blame. Otherwise, people will not report the errors if you keep blaming people. Yeah. Blame the system. Go do the root cause analysis. That's what you should do. Then we have got our, so I just explained this to find, yeah, some more tool if you want. Oh, still people are there. Okay. Well, okay. So let me take one more, one more. See, if you remember, I was talking about cause and effect diagram, Pareto analysis. Then you can further investigate, you can further investigate, look at the causes. You can validate those causes using some more tools. So let me show you that. Okay. Okay, I'll show you some. I'll show you the project after a while, but let me explain this concept to you. See, whenever we want to, whatever we want to improve, we wanted to improve the patient discharge time. That is our why. And the causes, like for example, discharge summary time is taking long time. Okay. Then we have got reports are, there's error in a report by mistake, some name is incorrect, some minor or some error is there. So inaccurate report. Inaccurate report could be one of the reasons. There were so many, if you remember, two of them were discharge summary time and reports not accurate. So if I want to examine, if I want to take an action on them, if we want to investigate, if you want to invest money to tackle these issues, you should be confident. You should be very confident of solving these problems. So now, how would you be confident? See, if you say, I want the patient discharge summary to be automated, no one is going to invest $500,000 for that, unless you're pretty sure that that is the root cause. How would you make sure? So what you do is you collect the data, say summary time, discharge summary time. You collect the data. And then you say, and the patient discharge time. Now, patient discharge time, the patient discharge time is, I'm just taking some example now, just to explain the concept to you. It took, say, 20 minutes to write the discharge, summary, and it took me 200 minutes. When it took 40 minutes, it took 260 minutes. When it took 100 minutes, it took 290 minutes. If 120 minutes, it took 330 minutes, and so on and so forth, 150 minutes, and it took, let's say, 350 minutes. So you can see that as the discharge summary time is getting increased, discharge time of the patient also increases. But that means there's a direct correlation, and we can say that if I reduce this somehow, it will have an impact on the patient discharge time. Yeah. So it is a root cause. But let me give you a different scenario. Suppose my patient discharge time was, let us say, 20 minutes. Still, I took 360 minutes. It doesn't matter. Patient discharge summary was created very quickly, but still I took 5 hours. 40 minutes, it took 240 minutes. 100 minutes, it took 330 minutes. 120 minutes, it 240 minutes. 150 minutes, it took 390 minutes. Now, in this situation, there is no relationship. If you see, patient, this X, this is our X factor, this is our Y. This is our Y, this is X. There's no relationship. Means patient discharge summary could be anything. It has no relation with the patient discharge. That means even if I reduce this summary time, even if I automate this, it's not going to impact the patient discharge time. So why should I automate? It's not the root cause. I'll waste my money if I automate the process, thinking that patient will be happy. No. Yeah. So this is how you validate using these charts. So just one more tool you just saw is, we call it scatter plot. So we can examine. Let me show you that. So let's examine, is discharge time getting affected by the discharge summary delay? After that, we'll examine, is discharge time affected by the pharmacy delay? Pharmacy time, because time taken to get the medicine, maybe they are responsible. So what we do is we examine scientifically. We examine looking at both the hypotheses. It may be the root cause, it may not be the root cause. So we examine, we make a scatter plot. It could be done in Excel sheet also, it could be done. So let us look at this patient discharge time and discharge summary time. Oh, it appears that they are related. They are related. Yes. That means it is validated root cause. I should take an action on patient discharge summary delay. Otherwise, there is in no way I'm going to reduce my patient discharge time. But what about pharmacy time? Should I improve that process also? Let us see. Patient pharmacy time to taken to get medicines, etc. There's no relation, it won't impact too much. So don't focus on that part. You'll be wasting your time. So that's not the root cause. So this is how you validate. I hope you learned some more tool. Yeah, there are many tools like this. I can go on and on. To learn all the tools, you're most welcome to join my sessions. Online sessions are there, and or otherwise you have got my in-person trainings. Feel free to connect with me. I'm happy. I'm enthusiastic trainer at the age of 57 also. I am I still, I don't want to retire. So yeah, but I have reduced my face-to-face trainings now, but yeah, online trainings, I keep doing it. Face-to-face trainings, every month I keep moving around in the cities. Yeah, usually I stay in Australia, but my wife is a doctor. She's a pediatrician. She practices in Bangalore. So I keep visiting Bangalore. My daughter stays in Dubai. So, so I will go there. So, yeah. So it's like still family. I keep moving within those locations and keep conducting face-to-face sessions. Riyadh also. My son is like helping me in those consulting assignments in Riyadh, etc. So this is how I balance my life. And yeah, from anywhere I can do online sessions. most welcome. I hope you enjoyed the session. I would love to hear from you. And please connect with me on LinkedIn. You can follow me on LinkedIn, and I'll be happy to answer your questions in case you need any help. I'll be happy to, you know, reply to you in my LinkedIn message also. And if, uh, as they say, uh, if things go well, we'll meet. We'll meet in person as well one day. Yeah, thanks a lot. Please do write about us on the LinkedIn. Just if you find something useful, please post it on LinkedIn saying that you found this program useful. And yes, thanks a lot. I also do introductory course design for data analysis. Yes, I do that. I do that. Data analysis in healthcare. Data analytics in general, I do it. Yeah, and data analysis in healthcare as well. If you want, I can do the training for sure. See, in Lean Six Sigma is sort of data analytics. If you see the second half, it was about that. So I hope that answers your question, Harji. And please connect with me. My phone numbers are can be obtained from my team, or you can connect with me on LinkedIn. I'll be happy to connect with you. Where are you located, Harji? Uh, so, mhm. And thank you, Charles. Thank you, Darsha. How to receive the certificate of participation? You'll receive in the link in your mail. And oh, Haji, you are in US. Oh, you're attending from US. It must be, I think, what's the time there? Mm, it's the daytime or it is daytime, is it? Yeah. Yeah. Mahanur, okay, you're attending from Pakistan. Okay, great. I think for you, it's like a daytime again. Yeah. It must be, oh, morning. Oh, Haji, it's morning for you. Oh, so you got up early in the morning. Okay, Amani from Qatar. Okay, wow. Anyone from Australia? I am doing this program from Australia. Muni from KSA. Okay, fine. Okay, great. Some people are from Australia also. Great. Okay, super. South Australia, Darsha. Okay, great. I'm in Melbourne. Yes. Yeah. Okay. Thank you, Mahnur. Thank you. Thanks a lot. I have done program for Aga Khan Hospital. They came to Dubai. 25 people. They came to Dubai. I did a program for Aga Khan Hospital, Karachi. I remember that. Yeah. Mostly programs are done in Dubai. People like to travel, and then you that's how they. That's typically the people like to do the training programs in the different countries. Okay. That's welcome, Muhammad. Great. Uh, so I'll be happy to if you attend my sessions online. Most welcome. Thanks a lot. Okay, sure. Manur, most welcome. Yeah. Okay. And Haji, oh yeah, for US, we have US trainings in the US timings also. Or if you want, if you have a program and something you can schedule in US, 4, 5 people are there. I'll travel to US. I keep traveling. Once in a year, I go to US also, or UK as well. So please let me know in case some people are interested. I'm just doing it as a hobby now. So I don't care about too many batch sizes. It should be more like sharing the knowledge. It's a great pleasure. So we do courses, um, data analytics as well. Yes. Great. Okay, Muhammad, you are working as safety compliance officer. Okay, great. Okay. Thank you. Thanks a lot. So we'll see you then soon. I'll leave you with some videos. So my team will play some videos related to some other tools and techniques. You can still watch. And thanks a lot. Thanks everyone. Yeah. And so my team will be playing some videos related to some tools used in Lean and Six Sigma. The one which you saw was 635 technique already. Some other tools also are there. And FMEA we will not be like a 15-minute video, but you can watch. Definitely, please watch that. Strongly recommended. Yeah. Sorry. Hello. Yeah. My team can play some of the tools like brainstorming session is there, or if you want, you can play escape technique. Escape technique could be a good one. Or you can play because you can play the you just show me the ones which could be something related to what we had taught. You know, something related to leadership also, change management. If you have change management, we can think of, but keep it that. Yeah, please, can you do that? And boxplot we can put here for you in the chat box. You can watch it later on also. Even standard deviation also, if you are interested, everything is definitely there. Hello. 65 is already shown. Hello. 65 is already shown. Yeah. So what we have already shown is there's no point in showing, right? Sorry for that. Yeah. So 65 we already shown. So I'm just talking about. Okay. Let me show you. Just a minute. I'll show one brainstorming rules of brainstorming. Let me show you the rules of brainstorming. Okay. See, we have got these videos, which you will get. All of you will get these videos. I'll just show you these videos. How when you join our sessions, these videos stay with you forever. So, for example, and you can download Anexas app. These videos are present there as well. Yeah, okay. So these videos are.
Once we have collected,
for example, I was talking. Okay, let me show you one.
diagram or tree diagram.
5 why technique. Let me show you about 5 why technique. Ask why 5 times. Okay. So 2 things I will show you. First 5 why technique and then brainstorming sessions as well.
Root causes. We can use brainstorming to generate a lot of potential causes of the problems you defined in measure phase. You can use why to push for root causes. To push for root causes, start with your focused problem and then ask why several times. For example, focused problem could be customers complain about waiting too long to get connected to staff during lunch hours. You can ask why 5 times. Why does this problem happen? Because backup operators take longer to connect callers. Why? Because backup operators don't know the job as well as the regular operator or receptionists do. But why don't operators know the job well? Well, there is no special training. No job aids make up for the gap in experience and on-the-job learning for the backups. Why? Because in the past, the organization has not recognized the needs. But why? Because the organization has no system to identify training needs. So this becomes the root cause.
So if you ask why 5 times, you can get the root causes. Let me show you one, like some rules of brainstorming. Whenever you are brainstorming, so what are the things you should keep in mind? Okay, so let us see that.
Spends about the time, venue, topic well in advance. So they are mentally prepared for brainstorming. As I told you that brainstorming is used for either generating the possible root causes or getting the ideas to solve the problems. There are certain rules which need to be followed in brainstorming. The rules of brainstorming are: give equal opportunity to everyone. who's participating. So tell them to participate, and you can use different techniques. As I told you, we will be learning in the improve phase. Capture all the ideas, so document all the ideas, whatever is being discussed, whatever ideas the participants are given, someone should be there to document, or a scribe you can appoint to document all the ideas. Leave your designation and ego along with your shoes outside the meeting room. That means don't think that if you are senior, your idea carries more weightage. So obviously this ground rule should be very clear to everyone, and everyone should be encouraged to give an idea, and everyone's idea should carry equal weightage. There should be a non-threatening environment. When people are giving ideas, they should not be afraid of giving ideas. So you should create an environment where people should be encouraged to give the ideas. Also, we should ensure that wherever the brainstorming is taking place, there should not be any disturbance, so people are focused on brainstorming. Sometimes people might deviate from the topics. There is a tendency that some important issue crops up during the discussion. So at that time, you can always create a parking lot saying that, well, this idea or this issue is very, very important, and we can park it to be discussed after a while once we complete the brainstorming on this particular topic. We should encourage people to fantasize freely. We should not put brakes on our thoughts. So you can give some out-of-the-box ideas, you can give some wild ideas, and if people are giving you wild ideas, they should be encouraged. If you give a specific duration of brainstorming, we should try to complete the brainstorming within the time duration, and defer evaluation. Now, this is one of the rules which is often violated. People start discussing the ideas. Someone gives an idea and someone else says, well, it will not work in an organization. Or some other person gives an idea and someone else comments that, wow, it's a great idea. So don't evaluate. Reserve your comments for evaluation at a later stage. When you are generating the idea, when you are generating the root causes, they are not to be evaluated. You cannot say that it is a good idea or this is a very good root cause which you have thought of. No evaluation, just write down whatever is being suggested. Generate quantity, do not worry about the quality at the initial stages. So you have to generate lots of root causes, lots of solutions, more the better. A pearl diver, he dives into the sea to find the pearls. If he just collects 10 oysters, the probability of getting the pearl is very low. But if he collects thousands of oysters, the probability of getting the pearl is very high. So similarly, if you want to collect great ideas, some of the out-of-the-box ideas, some creative ideas, then definitely you should create more and more ideas. So how to generate those ideas? There are different techniques. Some of these
you already learned one tool, 635 technique. There are many other techniques also. Okay, great. Any other tool like escape technique is there? A team was able to locate. If you have, then just let me know. So today's program was kept in mind for Australian audience because that was an evening for them. So, but we also have for other time zones, we do conduct training programs in the evenings. And also on weekends for Saudi Arabia, we have Fridays and Saturdays programs and Saturdays and Sundays program also. Yes, please go ahead. Yes.
One of the simplest tools which we have used in the organizations to improve the processes is escape method. What is escape method? Let us have a look. Once you have mapped your processes, you are ready to use escape. So let us see what it is. Once you have mapped the processes, you have to list down all the process steps, and for each step, each process step, you have to ask these 5 questions. Can I eliminate that step? Can I simplify that step? Can I combine that step with some other step? Or can I automate? There are a lot of automation possibilities nowadays. You can ask that question and maybe you might be able to automate that process step. Or can I make this step parallel to some other step? Means can I simultaneously do 2 process steps? So escape, ESCAP. Now let me show you an escape done by a black belt. So here in the first column, if you see, we have listed down all the process steps. So there are in total 30 steps. So 30 steps have been listed down here. And now on each of these 30 steps, we are asking these 5 questions. So what are the 5 questions? Can I eliminate that step? Well, I can. There's a possibility. Or can I automate? Of course, that is also a possibility. Now, which possibility we are choosing, and we have to make a recommendation. And similarly, if you see, they have made those recommendations. So here in this case, they've combined these three steps. Step number 3, 4, and 5 have been combined, and whatever is the recommendation, and they have written it here. After that, you have to present this to your management and see whether management agrees or approves those recommendations. And if yes, then of course you have to make an implementation plan. So sometimes you will find that just 2 and 3 hours well spent on escape methodology can give you a totally different process. Maybe you are the first one in the history of this process. Maybe this process was designed 5 years ago, 10 years ago, and maybe you will be the first person to have a look at that process critically, because these processes, when they were designed, they were not aware of a lot of things which are nowadays available. Like they don't know that today we have WhatsApp. They don't know we have got a lot of automated tool or automation tools available. So why don't you do an escape?
Hello everyone. Let us learn about a very common concept that is so crucial that many companies that fail to understand correctly don't go very far in terms of success. We are going to talk about change management and its importance. So to begin with, we all know what a change is, something not many people like. How important it is to adapt to a change? Does change management really affect the organization? Change management is a systematic approach to deal with the change or transformation of an organization's goals, organization's processes, or organization's technologies. The focus of change management is to execute the strategies for affecting the change, controlling the change, and helping people adapt to the change. Why change management is important? It is important because failing to adapt to changes will not only cause downfall, but also if companies and organizations don't change positively, then how will the world progress? Let me take a very famous company. I'm sure you all would have heard about Toys R Us. The company controlled 25% of the global toy market in 1990. The reason behind their downfall was the failure to adapt to change to new technology. Unlike its competitors, which were embracing new technologies and innovation to adapt to the changing preferences and buying habits of the new generations, Toys R Us failed to adapt and ultimately lost its global power. We all know a similar story about Nokia too. When a company so huge can have a downfall due to lack of change management, then it is a lesson we all must learn and should not take change management lightly. Let us now talk about different types of changes. Changes can be broadly classified into 3 types: transitional change, development change, and transformational change. Traditional changes are performed by senior management to steer the company from one direction to another to make sure that the problems that the company is facing are resolved. Development changes are changes that are made in the company's policies to make sure that the already established processes work at optimized efficiency. Traditional changes are the changes which create most impact. They change the fundamental concepts on which the company is based and also the operations and the core values of the company. Most popular model of change management is Lewin's model, which has 3 stages: unfreeze, change, and freeze. Let us look at them one by one. The first one is unfreeze. The first stage of change involves preparing the organization to accept that change is necessary, which involves breaking down the existing status quo and creating dissatisfaction with the current performance. The management needs to issue a compelling message showing why the existing way of doing things cannot continue. This is easiest to frame when you can point to the declining sales figures, poor financial results, and worrying customer satisfaction surveys. You need to change the beliefs, values, attitudes, and behaviors that currently define it. Using the analogy of a building, you must examine and be prepared to change the existing foundations, as they might not support add-on stories. Unless this is done, the whole building may risk collapse. When you start questioning the way things are done, you put everyone and everything off balance. You may evoke strong reactions in people, and that's exactly what needs to be done. Now you effectively create a controlled crisis, which in turn can build a strong motivation to seek out a new equilibrium. You get the buy-in and participation necessary to effect any meaningful change. The second stage is introducing the change. After uncertainty created in the unfreeze stage, the change stage is where people begin to resolve their uncertainty and look for new ways to do the things. People start to believe and act in ways that support the new direction. In order to accept the change and contribute to making it successful, people need to understand how it will benefit them. Here, there will be resistance to change which needs to be dealt with. I've talked about strategies to deal with resistance in another video. Time and communication are the two keys to the changes occurring successfully. People need time to understand the changes, and they also need to feel highly connected to the organization throughout the transition period. When you are managing change, this can require a great deal of time and effort, and hands-on management is usually the best approach. The third stage is refreeze. When the changes are taking shape and people have embraced the new ways of working, the organization is ready to refreeze. The outward signs of the refreeze are a stable organization chart, consistent job descriptions, and so on. The refreeze stage also needs to help people and the organization internalize or institutionalize the changes. This means making sure that the changes are used all the time and that they are incorporated into everyday business. With a new sense of stability, employees feel confident and comfortable with the new ways of working and don't go back to old habits. As part of the refreezing process, make sure that you celebrate the success of the change. This helps people to find closure, thanks them for enduring a painful time, and helps them believe that future changes will be successful. So that was all about change management. Don't be afraid of adapting to changes. After all, it is not the strongest or the most intelligent who will survive, but those who can best manage the change. Happy learning.
Happy learning. Thanks for taking out time to watch this video. To learn more, check out our other videos. Link is given in the description below. Subscribe to our YouTube channel and have a great day. For more information, you can write to us on inquiry@anexas.net.
Many people ask me why they should be going for a Lean and Six Sigma certification. In fact, there are lots of reasons to do that, but let me tell you top 3 benefits. The first one is, if you are a Lean Six Sigma green belt or a black belt, you can improve any process in any industry. Now, which organization would not like to have a person who can improve the processes, reduce the costs, improve the profits, improve the customer satisfaction, and they reduce a lot of waste or rework happening in the organization. So that is one. Second is, by getting certified from a reputed organization like us, and let me tell you, I love to train people. I would love to train you too. If you get certified, this will definitely improve your employment opportunities, because nowadays Lean Six Sigma green belt and black belt certifications are no longer good to have or nice to have. They have become must have certifications. Many of the job opportunities, and you can look around, they want you to be a Lean and Six Sigma, a certified professional. Even though you don't want to change your career to a quality professional, still, as a Lean and Six Sigma Green Belt and Black Belt, you are able to contribute positively towards whatever job you are doing. So that was the second one. And the third reason is that in the long run, if you want, you can be an independent consultant like me. That means once you have got the skills to improve the processes in the organization, and if you have practiced this a little bit more, once you are a black belt or a master black belt, you can confidently walk into an organization and say, yes, I can solve your problems. And then you can be self-employed too. Of course, there are many more benefits, but if you have any specific question related to this, please ask your question in the comments, and I would like to give you an answer in my videos. Lean and Six Sigma is an improvement methodology which reduces costs, defects, errors, cycle times, and increases the customer satisfaction, resulting in better efficiency and higher profits. In short, it does whatever a CEO or a shareholders want. It is used in all domains, be it manufacturing, services, oil and gas, IT, construction, banking, healthcare, textile, telecom, BPO, and whatnot. Here, we convert the improvement opportunities in the organizations to projects and train people like you who are working in these processes as green belts and black belts who execute those projects in 5 phases: define, measure, analyze, improve, and control. In define phase, we set the direction for improvement by writing a problem and goal statement and forming a project team. In measure, we collect the data and understand how the process is performing. In analyze, we analyze the root causes. We map the process, identify the waste, use cause and effect diagram, Pareto analysis, graphical analysis, and hypothesis tests. In improve phase, we generate ideas to take care of root causes using lots of tools like brainstorming, mistake proofing, FMEA, etc. And in control phase, we sustain the improvements for a long time by using process management and control charts. To become a black belt, you just need to know addition, subtraction, multiplication, division, and of course, a lot of fire in the belly. Do I need to tell you that? Of course, it is Anexas where professionalism meets fun and where people fall in love with statistics and process improvement. Well, that's what our clients tell us. And we take pride in telling that we are the best. If you are not doing Six Sigma with us, then you are missing something. Here are the 5 tips every Lean Six Sigma professional should follow. The first one, change of behavior is as important as the tools. People have the tendency to work around a problem rather than fixing it. And this is where Lean and Six Sigma inculcate willingness to constantly address problems that arise in business processes. When people are committed to change their behaviors, even the tools will be incorporated seamlessly. Training your workforce in Lean and Six Sigma is one thing, but without change in behavior, the whole process will be just academic without any practical implications. And the second tip is incorporating Lean and Six Sigma as a part of organization's goal and core strategy is one of the key ingredients for its successful implementation. And without that, the whole initiative will have a short-term life where people discard the methodology even before it is properly established in the organization. The third tip is about importance of senior management support. Organizations around the world will be tempted to apply Lean and Six Sigma in a bottom-up approach, but industry experts believe it is worth an effort to engage senior and middle managers first in these process improvement methodologies. Their engagement towards improving critical business processes will strengthen other associated behaviors, which will help in increased adoption by others as well. The fourth tip is about measurements. Organizations first need to understand that things that cannot be measured cannot be improved. By making proper measurement system in place, practitioners can decide on baseline performance and use the data to make informed decisions. By encouraging the participants to define both tangible and intangible measures, one can monitor the impact of their improvements and keep a database which will help in communicating the success to the organization. The fifth tip is about the customers. A satisfied customer is the best business strategy of all. No matter what business you are in, you should always put your customers first. Everything should revolve around your customers and their needs. Before you start making any drastic or even minor changes, establish the level of quality or requirements that you have promised your customers. Every decision you make should bring your company closer to delivering maximum value. So these were the 5 Lean Six Sigma tips for the professionals, and for more information, please subscribe to my channel.